The reason we're only offering it to the over 75s is because looking at the data, it's that age group where the risk of hospitalisation from COVID increases and nearly triples 6 months or more after their previous booster. The younger age groups, we don't see that increase in hospitalisations. So that was the main reason why we're offering it to the over 75s.
Director of Public Health Helen Carter said the GHA is aware there's been greater complacency on COVID over the past 18 months, with under-testing and under-reporting.
The World Health Organization are still classifying it as a global public health emergency. And that's because in some countries where there isn't as good vaccine coverage, we're sadly seeing quite a number of deaths still directly resulting from that COVID infection. Now, fortunately, the virus has mutated over the years from the initial strain. You might recall the Delta, the Omicrons. We were going through the Greek alphabet. Fortunately, Omicron is causing for most people much milder illness now, and that is a good thing because we're naturally boosting our immunity through that ongoing milder infection. Unfortunately, we're still seeing, a slow trickle of people who are being hospitalised and sadly deaths where COVID is listed on the death certificate. But that is significantly less than where we were in the early stages of the pandemic. So we are continuing to monitor people. We're continuing to identify the vulnerable. We follow up positive cases to check if they're eligible for antivirals. So we still screen out people and work out who would benefit from antivirals to try and prevent those hospital admissions.
As from 2021, there's been a yellow card reporting scheme to look at health concerns arising from vaccines. Helen Carter told Gibraltar Today no issues have been flagged during her time as Director of Public Health, and that a surveillance system is in place to monitor possible vaccine side effects. She added concerns about vaccines are a fact of life.
So throughout my professional public health career, we have consistently had an anti-vaccine lobby. I've met with some groups of that lobby here, and we've had a very reasonable conversation. This has spanned many decades in the UK. Probably initially came to the fore as a result of people's concerns around MMR vaccines, for example. Those concerns around the MMR vaccine and the work of Wakefield were then discredited in the scientific literature. So I'm very used to having those conversations with the anti-vaccine groups about a whole range of vaccines. This is not just limited to COVID. I think my conclusion is that we come from very different opinions, and there is nothing that I can necessarily say that will change their minds and vice versa. And I think we have to reach a point where this is freedom of speech. People are allowed their opinions, and this is where I'd encourage people to do their reading, to do their own research around vaccines. We've put information on the refreshed public health website, linking through to all the vaccines that we utilise. And I think fundamentally with some of the hard, fast views of the anti-vaccine community, we would have to agree to differ on those.
Around 100 have been seen in clinics with suspected long COVID. Helen Carter says this remains a concern and treatment in this area is evolving.